Well, I was a distance runner in high school and college. Ran cross country and track and ran a few marathons and held my high school 2-mile record for 22 years. And I retired undefeated because they switched from miles to kilometers, so they just took it off the wall. So we were here working for, Dignity Health. I was their manager of acquisition data conversions, which means every time they brought in a new clinic, I would go convert all their medical records to electronic format and bring it into their EHR. I'm sorry, I've been working in EHRs for 30 years. I know that, I know what you've been going through the last 15 years, I really do. But so I was feeling pretty good, so I wanted to get back in shape. So I started running, I got up to about 4 miles a day and started passing blood. So I went to my urologist, figured the old guy's just pushing it a little too hard. So he ran a scope and said, come on back. Came back a few days later, and I thought he was just gonna tell me to ease up a little bit, you know, you popped a blood vessel or something. And he came in and he said, Mr. Evoy, I've got some bad news. He said, you've got a stage 2 tumor on your bladder, and you're gonna have to have surgery and remove your bladder and probably your prostate. Boy, that shot me out of the saddle. Man, life was good. Everything was going great. I had my dream job and all that, and well, can we just get this over with real quick? He said, now we've got a surgeon here in the area that does these types of procedures, and I didn't even like the way he said that. I said, if it were you, doctor, where would you send yourself? He wasn't with Dignity, he was with one of the other big groups. He said, I'm gonna refer you to UC Davis Cancer Center. So when we left the clinic that day that the doctor gave me the news, my wife said, you know, it was the strangest thing. Before he came in and gave us that news, this little phrase kept going over and over in my head. Trust me. And I wondered what that was all about. But now I know who said it, and I know why. So a little while later, I met Dr. Delara, surgical oncologist here. What a terrific guy. And he's not too bad of a surgeon either. He said, we got 2 choices. We could just run a conduit out through a catheter and hang a bag off you for the rest of your life. Or I can take a 6-inch section of your lower intestine and I can build you what we call a neobladder. And it will remain internal and it'll function the way your bladder does now. And I thought, well, running a marathon with a bag hanging off my leg is probably going to be a little problematic. So let's do the other thing. I had no idea the consequences of that decision. So October of 2015, I went through 6 weeks of chemotherapy here at the Cancer Center, and I thought I looked pretty sexy bald, but my wife not so much. So she wouldn't let me keep it. And on January 13th of 2016, Dr. Delara built me an ileal conduit neobladder with a Studer pouch. And I am amazed at what our doctors can do. Because I can still pee like a big boy. He came in the next day, he said everything went great, able to do everything we could do, needed to do, you're good. And while I was chatting, he happened to mention that this thing called a radical cystoprostatectomy has the highest rate of post-op complications and the highest rate of hospital readmissions of any surgery in medicine. And I said, thank you for telling me that now. Can I have a warranty redo here? I would have done it anyways. My wife will tell you if there's one thing I am, it's a risk taker. But my complications started immediately. I had ileus, developed urine leakage, malnutrition, just wasn't gaining the weight back, tough struggle, in pain. And after it was 6 days before I finally told my nurse Janice, I think I finally have to go to the bathroom. Well, that was good news. So she helped me to the bathroom, said, when you're done, just flip that little switch. So when I was done, I dutifully flipped the little switch. And the door opened, and in steps Janice. And that surprised the heck out of me. I'm not used to pretty girls wandering into my bathroom. I said, why are you here? Oh, I'm going to help you. And when I realized what she meant, I got pretty squeamish. I said, yeah, that's okay. I've been doing this since right after diapers. I think I can handle it. And she stared me hard in the eye. I have to help you. And that was the end of that discussion. So while I underwent the most humbling, not humiliating, but humbling experience of my adult life, I said, tell me, Janice, when you were dreaming of becoming a nurse, thinking of all the wonderful ways you were going to help people in their time of greatest need, did this come to mind? She looked me right in the eye again. I signed up for all of it. And I realized, boy, the average civilian driving by here has no idea what these people do every day. Well, a couple days later, I asked another nurse, why did you choose nursing? Well, I didn't choose it. It chose me. And I knew exactly what she meant, because I'm a PK, preacher's kid. My dad was a pastor in the Free Methodist Church back in Michigan. 2 of my older brothers were Free Methodist pastors. I've got 2 nephews that are Free Methodist pastors, and our son is a Nazarene pastor. You ask any pastor why they chose it, and almost without exception, they'll say the same thing. I didn't choose this. God called me. And they use the term, it's a calling. And after spending 4 months here, under the care of dozens of nurses and doctors and psychiatrists and everybody else, I am convinced that you too are called to do what you do. Does that make it easy? Twice while I was growing up, my dad had to step out of the ministry for about a year each time. When I was 8 years old, he took a job in a factory and made metal tape measures for about a year. When I was in high school, he stepped out again, drove a school bus. Does that mean he wasn't called? It meant he was human, and he needed to be recharged and cared for my mom. So when I hear about a program like this, I get it. And I'm glad you've got this resource to help you through what could be a tough time. Well, it was 12 days before I was discharged. But Dr. Glass, my resident surgeon, she told my wife, you keep a close eye on him. Maintain a low threshold for readmittance. Because I wasn't doing very well. I lasted about a week in pain, couldn't keep food down, brought me back into the ED. Check it out. Well, for first thing, you've got right lung pneumonia, but you've also got abscesses in your intestines. And they said, man, we're going to have to bring you back in. So it's no wonder those statistics are so high. Everybody ends up back in there. So while they're getting ready to readmit me, the ED nurse comes in and he tries to ram a garden hose up my nose. I mean, that NG tube was that big around, and I'll tell you. And I fought him pretty good. And he had to bring in a buddy to pin me down while he got that thing down me. And that was my first hand-to-hand combat with a nurse. I thought, maybe these people aren't my friends after all. Well, they put me back up on Davis 12, which for the next 3 weeks, they tried to resolve all that. They tried to drain the abscesses. They couldn't get to them. Bad position, getting worse, getting worse. Put me on Dilaudid. I love that happy button. But after 3 weeks, it was like, we got no choice. We're going to have to do more surgery. So they took me down to clear up the bowel obstruction, and they gave me a transfusion. I was kind of anemic, and I started running a fever, and they said, looks like he's having a transfusion reaction. So they pulled the plug on everything, canceled the surgery, took me back up on the floor, and it wasn't a transfusion reaction, it was good old sepsis. So it took them 2 or 3 days to get that squared away, to take me back down to do the bowel obstruction surgery, which was successful. I lost another piece of myself to you folks here. But that's where it gets really weird. Because when I woke up after that laparoscopy, I couldn't remember why I was there. I said, I got a bunch of rubber coming out of my belly, so something happened. I wonder what. And later that day, a lady comes into the room, and I said, hey, this is probably going to sound a little weird, but I don't know why I'm here. Can you remind me what happened? And she just looked at me. I said, no, I mean it. I don't remember why I'm here. And she just turned and went about her business. And I thought, well, that was rude. I said, ma'am, I'm serious. I'd like to know why I'm here. And she wouldn't talk to me. Now, my favorite t-shirt is green, has a Celtic symbol on it, and it says, I can't keep calm, I'm Irish. And so, true to my national heritage, I sat up in bed and I said, look, sweetheart, I would like to know why I'm here. And this guy comes in the room, and before I can say a word, he grabs my forearm with both hands, and he kind of twists his hands in opposite directions. Man, it hurt. And it shocked me. I said, what are you doing? There's no need to get physical. I'm just asking why I'm here. And I tried to pull away, and he wouldn't let go. 3 more guys come in the room, and they all start fighting with me. I'm going, what in the world is going on here? Why are you doing this? And one of them brings out a pair of white, puffy mittens. And they put those things on my hands. I went crazy. I mean, it was a panic attack. I couldn't grab anything. I couldn't scratch my nose. I went nuts. I fought those guys with everything I had. And they pinned me to the bed. And they strapped me down. And they just all left. And I cried out, God, what just happened? Who are these people? Why did they do this to me? And all day long I laid there scared to death. That evening she came back in, and all she did was shut the lights out and left. And all night long I prayed, God, what's going on? And the next morning she came back in. She put her face right down in front of me. Now, are you going to behave, or are we going to have round 2? And I said, how can you say that? How can you be this way? And my wife came into the room. I said, oh, Deb, something's really gone wrong here. I'm having short-term memory loss. I don't know why I'm here. Nobody will answer my questions. And she's trying to calm me down. Jeff, it's okay. You're okay. And I realized that she's not going to answer my question either. And I got angry. And I grabbed her arm, just the way that guy did to me. She cried out, Jeff, you're hurting me. Do you want to hurt me? Yes, I want to hurt you. You're with them. In comes the goon squad again. Out comes those mittens. And I let go and I said, look, I won't fight you. Just don't put those things on me again. But they did it anyway. And they strapped me back down. And for the next 4 weeks, I didn't know if I was here or there, who was saying what. I traveled all over the world, I'll tell you that. I was on Navy ships, I was on Amtrak trains, I was in Russian countries, I was everywhere. And they kept moving me to a different hospital room every couple days. They put me down on the first floor, had French doors that opened up, I could hear the cars going by. I said, my office is right down there on Zinfandel, I'm going to be there before you know it. Next thing you know, they moved me to the Marriott. And I thought, man, this is a classy hospital, man. This is a beautiful room. Kept moving me all over the place. I had construction workers in my room too, hanging sheetrock. What are you guys doing? Isn't this hospital done yet? Craziest thing was what you nurses kept saying. Came in one day and said, oh, good evening, Mr. Evoy. Good night. We're going home now. I said, what do you mean you're going home? Well, we shut down at 8 o'clock. We'll see you in the morning. I said, but what if something happens to me? Oh, you'll be fine. I said, this is the stupidest hospital I've ever seen. The nurses all go home at night? I mean, it was that weird. One of my rooms was up, it was a finished garage attached to a really nice resort up in the Sierras. And my sister Betty came to visit me that day, and we had a wonderful chat. And it was beautiful. I still remember her leaning over and kissing me, telling her she loved me. I could paint you that scene right now, because that's what I saw. And this is what Betty saw. Man, how does that happen? My nephew Steve, the pastor, was pastor in Ripon at the time. Nurse would have to call me at night, or they'd call Deb at night. He's having an especially hard night. He can sense when you're here. And she would get out of bed, often after midnight, drive up here from Elk Grove, and sit beside me. Steve came in one night, he said, "Aunt Debbie, let me take the night, you go home." He said, "Uncle Jeff, I watched you fight those restraints all night long. You were like a bear trying to get out of a cage. And by sunrise, you had succeeded in freeing your left hand. And you were reaching for your right hand. I had to turn you in, Uncle Jeff." You cried out, "Steve, how could you do it?" He said, "I had to, Uncle Jeff. You kept pulling all your tubes out." So see, delirium doesn't just hit the patient, it does hit the family and everybody else around you. I didn't know what happened really, even after I was discharged. For months, it was like, what a weird memory. What happened back there? I finally ordered a copy of my medical records, and I'm glad I didn't have them printed out. 5,500 pages. 2,500 pages of progress notes, and I've read them all. And I couldn't believe what was really going on. Those nurses didn't know what to expect. Found patient lying on the floor, no apparent injuries. Found kneeling on the bed in a prayer position. Tried to get up and go to the bathroom, all tangled up in his restraining belt. By the second days, the doctors are going, what in the world is going on with this guy? Is he in depression? Is he in hypotensive delirium? They didn't know. They finally had to bring in the psychiatric team. I had 6 psych evals. First one, psychiatrist says, "I cannot assess this patient's mental state at all. He just stares." But while I was here, the nurses tried to fix his tubes, and he kept fighting them, moaning in pain. I read a note dated 8 days after the laparoscopy, and I fell off the chair. "Has not spoken since the surgery." You gotta be kidding me. I've been yelling at you guys from the minute I woke up. Mumbles incoherently, cannot understand. No wonder nobody was answering my questions. I wasn't saying anything, but I was. 3 weeks after the laparoscopy, the note says, "Wife reports, he said, 'Good morning.'" And about a week later, our granddaughter Kayla was sitting in the room with her mom and my wife. And all of a sudden she just exclaims, "You guys, I can understand Grandpa." And I started my journey back to the land of the living. And it was a tough journey. Delirium ended up being the least of the problems. Every time I turned around, something else was going wrong. I gotta read the list because I don't remember them all. Well, first thing was a blood clot in my right thigh. Man, they were sweating bullets over that. We gotta get him on oral anticoag. He can't take it. Put me on a heparin drip just to hopefully keep that in check. I mean, besides obstruction, multiple sepsis events, heart problems, tachycardia, heart rate over 130, blood pressure over 190. He has no cardiac history. I'm a marathon runner, for crying out loud. What's with all the heart problems? GI bleed, hypernatremia, hypochloremia, acidosis, kidney damage. I'm stage 3 kidney disease for the rest of my life. Don't know where that came from. Pelvic hematoma, GI bleed. It just kept coming. Every morning I'd have anywhere from 6 to 16 doctors standing around my bed at 6:30. I had 9 different teams working on me. And they would discuss what we're gonna do or what we're still talking about doing. And I would get so frustrated. Can't you just fix me? And I'd try to leverage them. I'd try to get under their skin. You guys just want me to die. You want one more thing to hit me so you can just get me off your list. That didn't seem to faze them too much. And one day I just had enough. And they were talking about putting the feeding tube in me to try and get the NG tube out. And they've been talking about it day after day after day. And I finally found out that they were arguing about it. GI guys and surgeons wanted to put it in. The urologist said, we can't do any more procedures on him or we'll kill him. Finally, they were standing around there in the morning and I said, you guys have been talking about this feeding tube for 17 days. I said, can anybody standing around this bed actually make a decision? Nobody said a word. They all turned and walked out. And I said, Jeff, you idiot, you can't talk to these people like that. After all they've done for you, that's your gratitude? They're out there right now lining up to take their name off your case. Nobody wants to work with you. I'm not sure doctors are allowed to do that. But that evening, the GI guy came into my room and he said, today's my last day on your case. He did. He really said, I'm done with this guy. Well, no, he made the decision. We are not going to put in the feeding tube. And I thanked him for his decision. A long time, I've asked Dr. Delara, can I please have the names of those doctors? I owe them an apology. He said, Jeff, forget it. Let it go. I think doctors could use a class like this too. I wondered why, when the nurses and doctors came in the morning, the first thing they would say was not, how are you doing, Mr. Evoy? It was, where's your wife? Is Debbie here yet? I said, well, I love her, but why do you love her? Well, I remember one time a doctor was doing something with all my tubes, and they had taught us how to do the catheter flush. We were really pretty good at that. And we wanted to go on a game show, but nobody wanted it. But she was just standing right beside the doctor, helping him out. And he turned and he says, you would make an excellent nurse. And I was reading a note, big long paragraph, critical thing going on, several doctors and nurses in the room doing something really serious with me. And right in the middle of that paragraph, wife is standing at the bedside, working hard. Why would they take the time to acknowledge that? And then I found the note that answered the question. He's much more cooperative when wife is present. She said, oh man, they would never try and change your wound dressing unless I was standing right there. So yeah, I married a nurse even though I didn't know it. I thought she was a school teacher. That dumb NG tube kept getting plugged up. Doctors say, oh, replace it. I would beg you, please, don't pull that thing out and put another one in. It hurts. And you guys had my back. You would fight with that thing, try and free it up. You couldn't do it. I had a doctor spend an hour one time with the little wires and Coca-Cola, and he couldn't do it. But there's a Nigerian nurse on Davis 12 by the name of Demelash, who is a master plumber. I mean, he has the NG knack. And he could come in there and get that thing flowing again when nobody else could. One morning at 8 a.m., it plugged up. No, Demelash just went home for night shift. He won't be back for 12 hours. And you guys had my back. I kept begging you, please don't pull this thing. And I don't know how you kept it from the doctors or what. I mean, by mid-afternoon, I was starving to death because that was my food supply, too. I said, I don't care how hungry I get. And at 7:30, when he walked in the door, I have never been so happy to see a nurse in my life. And he brought the weapons in. He had 2 or 3 different syringes, and he had the little coil of wire, and he had Coca-Cola, and he looked like a surgeon laying it all out there. And he went to work, and he fought that NG tube for 2 hours. And he finally got that thing flowing. And he started hopping around the room, waving his arms. I got it working! I got it working! And I have to ask you, why do you people do that kind of thing? It's not in the care plan. You violated doctor's orders. You said replace it, but you didn't. And you let him keep a tired, beat up, weak, old, frightened man from having to experience any more pain than necessary. He's my hero. Love that guy. Well, we finally reached a point where things started getting resolved. Sepsis resolved, all kinds of other things kind of getting resolved. By then I had lost 44 pounds and I couldn't even move myself in bed. And Mike, the physical therapist on Davis 12, came in one morning. He said, "Mr. Evoy, the doctors want you to start walking." I said, "Where?" "They want you to do a lap around the unit 3 times a day." I said, "Mike, I can't even lift my head off this pillow. How in the world am I going to do that?" And he looked me right in the eye. "If you want to get out of here, you're going to have to make the effort." And I knew he was right. And all my cross-country training came back to me. You know how a distance runner becomes a better distance runner? They go out every day and they make it hurt so bad that their legs are on fire, their lungs are burning, and they just want to puke. And if you do that regularly and long enough, you get to be a better distance runner. I mean, that is a great sport, isn't it? And I just said, "Jeff, it's time to go back to cross-country camp, and you're going to have to make it hurt. And you're not fighting for trophies and medals. You're fighting for your very life." And Janice came in later that morning and said, "Mr. Evoy, are you ready to go for a walk?" And she had to coach me how to get out of bed. I said, "Turn on your side, get your elbow underneath you, and then you're going to push up while you swing your legs down." And it took every ounce of strength I had to stand up behind that walker. And I shuffled to the door, and I looked down that mile-long hallway, and my heart sank. I said, "I can't do it." And she put her hand on my arm. She said, "Let's not go all the way around." She said, "How about if we go just to right there?" And she walked every step of the way with me. And she kept encouraging me. "You're doing great, Mr. Evoy. You're looking good. You got this." I don't know how I did it, but I made it to that point. And I sank back into that bed and I cried out, "God, how did it ever come to this? Am I going to leave here alive? Or is this it for me? And if I do leave here alive, what am I going to be? A vegetable that my wife has to wheel to the bathroom? If that's it, kill me right now." My chart says walked 100 feet. Felt like 100 miles. And we kept walking. New guy joined the night shift. Young guy, so full of life. Come in every night and just shoot the breeze and chatter. He was so upbeat, he had to be a rookie. He had not been beat up enough yet, man. He was too fresh. "Mr. Evoy, I want to walk with you." Every night. Finally one night, "Mr. Evoy, can I walk with you tomorrow morning?" "Sure." At 6 a.m., Junior comes bouncing in the room. "Good morning, Mr. Evoy. Are you ready to go for a walk?" And I looked at the clock and I thought, "Kid, you need to find yourself a hobby." No, we went for a walk. And it hit me, that walk was as much for him as it was for me. He was not content to just observe my care. He had to care for me himself. He's got a nurse's heart, and he's going to have a great career. Kept walking. Deb came in one day, she said, "The nurses told me I can take you outside." I wasn't even dreaming of outside. Seriously. They bundled me up in a wheelchair. She heads me towards the elevator. Just the two of us. No chaperones. It was our first date in 3 months. And when those hospital doors opened and she wheeled me out under the open sky I couldn't contain it. It wasn't just that I'd been cooped up inside for 3 months. I didn't think I'd ever see this again. Feel the wind on my face, look at the clouds and hear the birds. It was just more than I could handle. And as she wheeled me down the sidewalk, it just hit me and I got scared to death. How in the world am I ever gonna function out here? I don't remember how to shave. I can't take a shower by myself. How in the world am I ever gonna go back to work? And this voice in my head said, trust me. And I just had to let it all go. And we kept walking. One day, a different nurse came in. He said, I want to take you around. I said, okay. So we're taking the lap around. And he says, oh, come here. And he leads me over to the desk where there's a nurse sitting and another one facing the other way. And he leads up to her and he says, this is the guy. She looks up at me. The other nurse wheels around and looks at me. Yeah, this is the guy. I said, what are you talking about? Oh, man. The call went out on the floor. And when I walked in your room, I couldn't believe it. You weren't just standing on your bed, you were surfing it. You'd pull out all your tubes and you wouldn't let anybody touch you. It took 4 of us guys to hold you down. I said, wait a minute. Did you put white puffy mittens on me? We had to. You kept pulling all your tubes out. I said, no, that was a nightmare. Are you telling me that really happened? It happened more than once. Hey, you want to write a journal article about those mittens? I forgot to tell you the most terrible part of the delirium. Every 2 or 3 days, the nurses would come in and take me out of the hospital to an old house near the hospital here that reminded me of Adam's family. Had these big old 4-poster beds in it, and they would strap me in there and they would torture me. They would beat me and they would hit me and I would cry out, why are you doing this to me? That's what I remember about those puffy white mittens. And I jumped down his throat. That I cannot possibly write an article about those mittens. I said, if I write an article, I'm going to demand names, and I want somebody to go to prison for the way I was treated. It is in my chart. Patient thinks someone should go to prison for the way he was treated. You guys, I was in delirium for crying out loud. I said, I can't do it. Well, we finished the walk, and I walk in the room, and there sits Deb, and I had to know. I told her what just happened, and I told her what I had done to her in my nightmare. I said, did that really happen? Yes. I asked her to forgive me. She said, Jeff, there's nothing to forgive. That wasn't you. Well, she knows that. You guys all know that. But how do I deal with that memory? Because I remember it all. My last psych eval, the psychiatrist said, I can't believe you remember everything. I said, I could write you a book. Which my professor says, that's what I want to do. I couldn't believe that it really happened. How can anything be so strong that it makes you want to hurt the one you love the most? We kept walking. Finally, one day, Janice came in, and I said, today is my solo flight. I don't want any help with anything. She stepped back and said, you're on your own. So I turned on my side, got my elbow under me, pushed up, swung up, got behind the walker, got to the door, and I looked down the hallway, and I said, I own you. Started my lap around the track unaccompanied. And as I came to each station, the nurses stood to their feet and applauded and cheered me on. Looking good, Mr. Evoy. You got this. That's when I knew I was going to leave there alive. I wanted to shout out I love you. But creepy old guy with the bed sheet and bags hanging all off him, tape on his feet. I'm sure that would have went over real well. So we skipped that part. Wasn't long after an occupational therapist came in. Can you tie your own shoes? Showed him I could. Can you go to the bathroom by yourself? Showed him I could. Let's go for a walk. Took me a lap around, watching me, my gait, my balance, seeing if I could drive a walker real good. Came back in, he said, you, sir, are ready to go home. I didn't even know how to take that phrase, because I could hardly remember what home looked like. I just knew I wanted to be there. Except now we got to get rid of a whole bunch of tubes, man. I had the gallbladder tube, I had all kinds of plastic hanging all off me. But that's what they started to do. Well, 3 days later, doctor came in, took that tube and bag off and plugged that hole. 3 days later, they came in, removed my Foley. They kept taking rubber and plastic off me until all that was left were the ureters to my kidneys that Dr. Delera had put in, 40 years ago by the sound of things. So he schedules me and we go in and he's going to take those ureters out. And I wake up and it's like, where's my suitcase? And the nurse comes in, Mr. Evoy, I got some bad news. I'm getting real tired of hearing that phrase. The surgeon couldn't find those ureters.
Oh.
I said, he's the one who put them in there. And he came in a little later, and I was in there for an hour. I couldn't find those ureters. But I did go back and check out your neobladder. I said, that thing's beautiful. I said, leave it to a surgeon to go back in and admire his handiwork, I said, well, that's nice, doc, but what are we going to do about the ureters? Well, I'm going to have interventional radiology help us out with that. So they wheeled in the big portable x-ray. They take some pictures. Yep, there they are. I have never prayed for patients. I don't know if you have. But if you want some, just get yourself put on IR's surgery schedule as a non-urgent case. You've been there, haven't you? So Monday goes by, and then Tuesday goes by, and then Wednesday goes by, and Thursday goes by, and by Friday I'm spitting nails. Come on! And Dr. Glass walks in, and I said, you drew the short straw, didn't you? She shook her head. They're not going to be able to get to you today either. And they don't do it on the weekends, so I have watched paint dry for 7 days in a hospital waiting for nothing. She said, we'll probably have to schedule it as an outpatient. I go, good grief. But Monday morning, nurse walks in, they can get to you in IR. I said, you either wheel me down there or I'm running. And I went in there and they got those ureters out. So when I woke up, I was truly plastic free looking for my suitcase. And Dr. Glass comes in. Mr. Evoy, I'm afraid I have some bad news. I don't like it when doctors say that. You nurses can say it all day. It's usually, the bed sheets or something, but no. Bad news. When we remove them, we could visibly see on the tips of those ureters. And we're quite certain that it has gotten into your bloodstream. The old hospital-acquired infection we've all heard so much about. I said, I'm not going home anytime soon, am I? We have to know what this is. My oldest brother, Larry, one of the two pastors, went into the hospital in Grand Rapids, Michigan for a pacemaker implant. How many pacemakers have been implanted in the last 40 years? Hundreds of thousands? And in his case, they also implant a virulent pathogen deep in his chest. And in 3 days, they knew he wasn't going to make it. And I went back and visited him. I wasn't allowed to touch him. He just stared at me forlorn. He said, Jeff, there was so much more I wanted to do. I said, Larry, you did everything God ever asked you to do. How many people on the earth can say that? And in 30 days, he was gone. So I know what HAIs are. And I thought, well, maybe it's my turn. By the next morning, I was in septic shock. Systolic blood pressure was 60. White cell count was through the roof. They rushed me down to MICU, and they hang 4 bags off me, 3 antibiotics and 1 antifungal, hoping one of them will be effective. Took them 5 days to even identify it. Candida gibrata, nasty little fungus, attacks the eyes, attacks the heart. Thank goodness, my one eye that's left. I lost my patch last week back in Michigan. I got to order another one now. Thank goodness my one eye is still here, but not so lucky with the heart. Went back into all kinds of problems, tachycardia, blood pressure. I got an internist and a cardiologist in the room putting meds down the central line, trying to stabilize my heart. And the internist leans over and talks just to me. Mr. Evoy, your heart has just gone into atrial fibrillation. So we need to get you back to a normal rate and rhythm ASAP. I agreed. He leaned over a while later, he said, Mr. Evoy, in the last hour, your heart has run a marathon. I said, well, I've run 5 of them, but never laying in a hospital bed. Well, 20 minutes later, he leaned over and he kind of gave me a little primer on what a heartbeat is. That was fascinating. You know, pulse starts at the base of the heart and travels up the walls and gets resolved into a heartbeat at the top. That was pretty cool. He said, but in your case, it's trying to do it over 400 times a minute, so it's not working. I said, I've been without a pulse for an hour and a half now. I said, why am I still alive? He said, I do not know. At the 2-hour mark, he leaned over and he said, Mr. Evoy, we have done everything we know to do, and we cannot get your heart to restart. And I thanked him for everything that they tried to do. And I closed my eyes and I said, well, Father, I didn't think it would end like this, but I'm okay, because you are Lord. But my Bible says that I can boldly approach you. So I'm going to ask you a favor, and this is not for me. But if you can find it in that wonderful heart of yours, would you not make Deb go through losing me right now? After everything she's been through this last year, it'll crush her, and I can't stand the thought of her being alone. I trust you, and so does she. And the room was silent. Internist standing right there looking at me, the cardiologist, eyes glued to the EKG at the foot of the bed. And just a short while later, he goes, whoa, your heart just returned to normal R&R. I said, really? When? Just now. I watched it flip. Now, why in the world did that do that now? I said, sir, you guys are good doctors. But I've got one more person on my care team, and I pointed to heaven. I said, and he's known as the great physician. And for whatever his reasons, God has decided he's not done with me yet. I was surprised by the scowl on the cardiologist's face. He didn't want to hear that. And I thought, you know, if someday you or somebody you love is facing the impossible, I hope you remember the day one of your patients just whispered a prayer, and God, and only God, restarted his failed heart. My chart says 2-hour AFib, self-corrected. I'm sorry, self had nothing to do with it. So we had to recover from all that. Am I ready to go home? I keep failing swallow tests. That dumb tube has really messed me up. I can't swallow anything. They put me on a pureed diet. Love that stuff. You know, that's another miracle of modern medicine. You can go out in the front yard and shovel up what the dog left and make it look like broccoli. I couldn't believe that stuff. I couldn't gag it down. And I'm whining to the ICU nurse. I said, I would cut off my left arm for a glass of orange juice right now. The next thing I know, he's back in the room and he sets a glass down. He says, here you go, it's safe. And he had thickened up orange juice somehow. I don't know if he used gelatin or what he did. But nothing in the world ever tasted so good. And I'm going to ask you again, why do you people do things like that? Not only was I not on the care plan, he got in trouble for messing with my diet. You've got to be kidding me. The guy has a heart for a patient, and you're going to slap his wrist. He's my hero too, and I don't even remember his name. But that's the heart of a caregiver, of a nurse that looks at what can I do to help you, to make you feel better, to improve. I hadn't had a good day in 4 months, man, I'll tell you that. Well, they're trying to make me work on all these exercises, and speech therapists, they're saying it's going to take you months before you can eat again. I said, man, I can see this plate of sweet and sour pork is just floating right there. When can I eat it? They said, it's going to be a long time. So finally, my wife researches and finds that there is an acute care rehab hospital up in Folsom that specializes in swallow therapy. I had no idea you get a PhD in swallowing, but I guess you can. So Vibra Acute Rehab Hospital. So we get all checked out, and the guy comes in, we're going to transfer to Vibra. Maybe they can get me back in shape a little quicker. And the rep is in our room talking about the paperwork, and he says, normally I have one of my nurses fill all this paperwork out, but UC Davis nurses are the best in the business. I always let them handle everything. So your reputation is out there, even amongst the competition. So we end up over in Vibra, 17 days, doing the weirdest exercises in the world. Stick your tongue here, put the ball there. It's like, I don't know, what am I supposed to do? But I finally passed a barium swallow test. And they didn't think I'd ever eat again. They were going to put the dumb peg tube back in me. But we made it. And I went home, and when they released me, they said, your biggest risk is you're going to come back, you're not going to eat enough. You're going to get malnourished, and you're going to come right back in here. You know what was most amazing to me? Is after I came out of the delirium, not one nurse ever even mentioned it. I didn't know I was in delirium until the last psychiatrist came in and said, I need to explain to you what delirium is. I said, what? Well, because you were in it for a month. Really? I was speaking to the executives a while back, and your chief nursing officer said, that just tells me how professional we really are. And then he also said, and I wondered if I would ever meet you. I said, what? Oh, your reports came across my desk, especially the one about you standing on your bed fighting off all the nurses. That's not how you want to introduce yourself to the chief nursing officer, but what can I say? I asked Dr. Delara, what is my recovery going to be like? He said, I don't know. I've never seen anybody go through as much as you have and live. It will take years, and it has. I got a job. I was off for 10 months, got a job working for Cerner Corporation for Adventist Health up in Roseville. And then I got an email from Edna on Davis 12. Every now and then, we invite one of our patients to come back and visit the staff. Would you like to come and have a lunchtime meeting with our staff? I said, you guys actually want to see me again? I thought you'd have an armed guard at the door, man. So my wife and I and our granddaughter Kayla, we go up for this lunchtime meeting in this beautiful cake, beautiful flower. When those elevator doors opened, it was not easy stepping into that hall. The demons were all there. And if it weren't for all those nurses smiling and coming up and hugging me and saying how good you're looking, I would not have made it. But I was looking for one nurse. And they finally said, oh, here comes Janice. And we hugged, and all we could do was cry. Couldn't get a word out. After a long time, she just looked up at me and shrugged her shoulders and went back on the floor. And 2 more times she came back in, and all we could do was cry. And I left and I felt terrible. I wanted to tell her what she meant to me. That girl went through hell with me. And she never gave up. None of them gave up on me. I had to go, it took me 2 weeks, I couldn't get her out of my head. I finally had to ride the shuttle back down and go back up there and chase her down, and we just stuck it out until we stopped crying and could talk. I go up there every now and then and say hi to her. Great group of people. But I just can't thank her enough. I've spoken at this several times. First time was really tough. It's getting easier. Actually, it's getting to where I crave doing it anymore. because of the feedback I've had. I've had nurses stop me in the hall there and say, man, thanks for talking. I'm still here because you let me know that's worth it. A couple times ago, a nurse was out there in the hallway just crying her eyes out. And she grabbed me, she said, thank you, sir, for coming here and making me remember why I do this. Well, I was speaking, and it was the first time I had the courage to share the nightmare. I'd never spoken about the delirium. Boy, for 2 years I didn't talk about the delirium. And I started sharing that story. And when I got to the part about putting the mittens on, I heard somebody in the back of the room weeping. Not just crying, just deep sobs. Everybody heard her. I checked out of the corner of my eye and she had her face buried in the tissue. Her friend had her arm around her. She was just shaking. And I thought, should I stop and see if she's okay? I didn't want to embarrass her, so I just finished the talk. And at the end, you could hear a pin drop. And then she stood up. I was your lead night nurse. When you started speaking, I couldn't believe it was you. Just look at you. Can I give you a hug? And Rosilla and I met at the center of the room. She said, you probably don't even remember me. You were so bad. But I cared for you when you were at your worst. I said, it was bad, wasn't it? Oh, it was bad. She shared a couple more things that they had to go through. Then she teared up. I was one of them who put the white mittens on you. We had to do it. You kept pulling all your tubes out. I said, I know you had to do it. And thank you for doing the really hard job. She must have said it 3 times when we were standing there. Just look at you. And then she turned to the whole group and she just pronounced it. It was all worth it. I hope you can realize that it is. I had a nurse a while back in one of these classes. She said, I'm in this class because of all the delirium patients I deal with. And for you to come here and thank me for what we have to do to you, it's made a difference. I said, you have to do it. Where would I be if you hadn't done it? 4 doctors said, there's no way in the world you should be alive. And about a year after discharge, I was working up at Adventist Health and a recruiter called. I see you have EHR and data warehouse experience. Would you like to talk to UC Davis Health? I said, I know those guys. A lot of them. Came down here, had one hour interview. They said, get him in here, he's our guy. So I've been here for a couple of years now, working on, I know you might not like that EHR, but we are extracting all the transactions from all 5 med centers. From San Diego, Irvine, LA, San Francisco, and Davis, we are digging all of the last 5 years' records and making a research database in one massive database, over 5 million patients. I worked at Microsoft on their data warehouse team when they were developing this product. And I used to tell them if we could ever put healthcare data into this data warehouse, not banking data, I said the research potential would be incredible. And they just laughed me out of the room. Where in the world are you going to get healthcare data? That was 1997. There wasn't any. But here it is, tons of it. It'll probably be ready for use within the next year. And I think the research that's going to come out of that is going to be incredible. And I thank the good Lord that I get to work on it. Because it's been my dream. I've been in healthcare IT for 30 years, and this has been my dream since I first understood it. And to be able to do it right here, give it back to the people that helped me. And Dr. Dallaire, you owe me. I want access to that data. I said, yeah, I guess I do owe you. It's going to be incredible. But the incredible thing is that I get to work here with you folks doing that. A guy by the name of Ray Boltz wrote a song, and in it he described what he thought it would be like to watch one of his friends go to heaven. I think she was a nurse. And he talks about how as she walks through heaven, people come up to her and say, "You don't remember me, but you were there when I needed you. You did this, you did that." And the last lines of the song are, "One by one they came, far as the eye could see. Each one somehow touched by your generosity. Little things you did, sacrifices made, unnoticed down on earth, in heaven now proclaimed. Now I know up in heaven you're not supposed to cry, but I do believe I saw a tear in your eye. As Jesus took your hand and you stood before the Lord, he said, 'My child, look about you. Great is your reward.'" He does say that when you do it to the least of these my brothers, you do it to me. So remember who you're really caring for. I can't thank you enough, and I'm glad I get to come here and thank you. I'm praying for you guys that you deal with what you're going through. I shared with a group of nursing students last week. I said, "How many nursing students in the class?" About 8 of them raised their hands. I said, "I'm about to scare you to death. But there are resources available should you need them when things get tough." Thank you. Any questions or anything?